Hi, Snackable Health with Gibson and Kohli, and we're talking about monkeypox today. Bring us up to date, Payal.
Mike, we've had so much experience now with infectious disease outbreaks, and this one has caught us a little bit off guard just because of the rate at which it spread outside of Africa, where we know that monkeypox is endemic. And, it's circulating on social media that it's a gay disease. And I really want to address that head on, especially because I think that kind of a misconception could potentially propagate the spread. So we know that monkeypox can infect anyone, regardless of their sexual orientation, their race, their gender. But we also think, based on how it's currently spreading, and because we're seeing it in men who have sex with men, that it could be spread through close sexual contact. So this does not necessarily mean it's through sexual transmission, meaning it's in the sexual fluids, but just close contact with somebody where you can come into contact with their droplets. We also know that contaminated clothing or sheets can spread it, and we know that we have an effective vaccine for it, which does work.
So when you say droplet, that sounds a bit like COVID. Are we talking about aerosolized droplets as the way it's transmitted?
I'm so glad you asked that because that's a confusion. So no, we are not talking about something lingering in the air or aerosol spread that's occurring. We're talking about direct contact with droplets. So that's really where that 6 feet radius comes in, where you have those big respiratory droplets. So this is not nearly as contagious as COVID, which is good news. You need close contact for prolonged periods to really get it, which could happen through sexual contact, for example. And unlike COVID, we also have a vaccine for it that's effective and works. And there's also cross protection with the smallpox vaccine with this as well.
Well, they thought the COVID droplets were big and that they would fall down and not be aerosolized. Turns out COVID was a little more of a mist. It could stay airborne for a while. And of course, we all know how that turned out. But it sounds like the feeling is very clear that this is not that fine mist droplet, but those bigger droplets that won't stay airborne and it will be transmitted in that way. That's good to hear, Payal.
Yeah, and wearing those masks will still protect you, Mike. Washing your hands, wearing those masks, wiping down the surfaces, it is definitely spread through respiratory contact. So just like with the flu and with adenovirus and the colds, those are great measures for us to continue to do.
Great. Thanks, Payal. Thanks for joining us today.